Welcome to the Optimized Business. For those just joining, I'm Nick Klink. With Precision AI Partners, we help consultants and coaches scale using AI automation to acquire clients and deliver better results while working less. Today, we are joined by Lawrence Thompson. He's the founder of Benefit Systems Incorporated. Since 2002, Lawrence has been helping organizations navigate complex healthcare challenges from private equity consulting to launching, innovative self-funded health plans. 40 years in the industry brings deep experience and fresh perspective to how companies could potentially rethink benefits. So Lawrence, it's a real pleasure to have you on the show. How you doing?
Doing great. Thanks for having me.
Yeah. Yeah. And where are you calling in from today?
I'm in Fresno, California,
Nice. West Coast person here on the podcast. So
sir.
he's going to bring a different perspective for sure. Now, Lawrence, I wanted to start off with, your journey. What inspired you to start Benefit Systems back in 2002, and how has the firm evolved since then? I know there were some, breaks in between where you got pulled in to consult from the inside, let's say, but how has, that journey been as a whole?
It's been a fabulous journey. And the way we started is actually kind of a mishap. I sold my third party administration company in 2000. I got requests from people in the industry to help with a project here or help with a project there. And I kept doing these projects. And finally, my CPA called me and said, "You just can't keep getting these checks. You need to create an entity if you're going to keep doing this." And so it wasn't really by intention. My intention actually was to kind of slow down my career at that point. But these projects were all interesting. So I just kept doing them. And before you knew it, we were, full-fledged consulting company.
So it just the money kept coming in and you were like, all right, I guess I got to start something here. And full-fledged consulting company. So you obviously probably started just as yourself. How many employees do you guys have today?
Well, we're an interesting way that we're set up. We're set up with partners, if you will, and there are 10 of us in the company. And what we do is we select people that I've worked with and I've known for a long time that are specialists in particular areas. So, for example, we have a partner who is an ex-CIO, has tons of tech background. And so anything on the technological AI side, we bring him in where needed. For legal, we have a tremendous relationship with a partner who she's a ERISA attorney and just super experienced. I work with her for many, many years. So that's kind of how we're set up because again, back to my early beginnings, I didn't want to have a bunch of employees. I'd just gotten out of a company where I had 130 employees, FTEs, and I just didn't want to be managing people anymore. And so I just started pulling in people I had worked with in the past or people I knew really well that had specific expertise in certain areas that we would have to use. And over the years, it's just grown. And now there are 10 of us. Um, we do have some support staff now, obviously, but yeah, the 10 of us basically drive it. And I kind of oversee the whole thing.
Nice. So, and I'm sure it's a lot more comfortable, obviously, if 10 is a lot less than 130. Does that mean, are they, full-time employees, or would it be more of kind of like a 1099 sort of thing?
They're all 1099. They're all independent. They work when we have projects, and when we don't, they're doing other things.
That
You
sounds
know, all
amazing. So
ERISA
simple.
partner is a part-time mock judge in a law school, and
Yeah.
it's just great because it gives all of us flexibility to do other things, but we're all very dedicated to what we need to accomplish here.
That's awesome. I've been seeing a lot more companies, from talking with people that are set up similarly, not having the full-time employees, but just having, good team that works when needed. And I mean, from what I've gathered, it seems to work pretty well for a lot of different companies.
Yeah, I joke with my CPA and tell him that I started the gig economy long before it became popular because nobody knew what gig economy was back in 2002.
Yeah. No, so I know along your journey since starting Benefit Systems, you were pulled into multiple leadership roles, COO, CCO, president. What's it like stepping inside a company versus kind of where you are now advising from the outside?
It's significantly different, right? Because you're much more immersed when you actually go inside of a company than you are as a consultant on the outside. And then secondly, you develop actual working relationships because we're all human, obviously, and you form, working relationships with people within the company that maybe you wouldn't as an outside consultant. And then, of course, third is, you pick up tremendous management responsibilities, which generally in a consulting role, you really don't have heavy management consulting
No, not really.
responsibilities. So it kind of changes things. And from my perspective, it's harder to be objective, to be honest, because there's lots of distractions. And it's less purity of task, I think, when you're on the inside. You really have to yeah, you have to have a lot of willpower and a lot of discipline to stay on task because when you're inside an organization, all the distractions and moving parts are there.
So that makes sense. So, kind of facing where you are now, can you describe your list to the listeners, kind of where your company is at the moment, what you guys are working on?
Well, we kind of have three divisions to the company today. One is what I call, you know, pure consulting, where we're brought in on a particular project or for a particular set of tasks. We have a set SOW, and that's the focus. And we still do quite a bit of that. The second area is what we call our solutions section, where we are really driving innovation. That's what it's all about. We're actually creating in that. So it's less consulting. It's consulting, but with creation attached to it. So
When you say creation, what could be like an example of something that you might get brought in to create?
we might be brought in for, let's say there's a big state program and it's running really badly, and we get brought in to completely redo it and restructure it and refocus it and change the way it operates so that it'll operate more efficiently. And that then allows us to bring in innovative solutions, creations that we have created, other data, other ways to look at things. So it really allows us to do a lot of stuff there. But also, and we'll get to this later on, I'm sure, we decided to take that one step further about 2 years ago. And we've actually decided to create something ourselves for us, which is Harmony Health. And we'll address that later on. And
Yes,
then
we
the
are. I'm
third
excited
division,
for that. It sounded really
yeah,
interesting when we talked about it on our pre-call.
yeah, it's really been a great project for us. And then the third division is, as you talked about, our private equity area, which is only about 2.5 years old. And that's where we work with, select private equity firms around the country. They come to us because we have such broad expertise in the healthcare space. So if they're looking to make an acquisition or a merger inside of the healthcare space, they come to us and then have us do a lot of different things. Sometimes we're just doing early evaluation, telling them, bid or not bid. Sometimes it's past the bid point and they actually want us come in and do full due diligence before they actually make a final offer. And in some cases, it's portfolio companies they already have that they want us to look at. So, that's been an exciting area for us to work in. And like I said, we've been doing that about 2.5 years.
Yeah. Well, and it's important to note too, for those listening, Lawrence was a part of that even before his company, right? He was brought in when those times he was president or CEO. There was often, that they were pushing for a sale, right? That's what he was brought in for, to get the company, up and as efficient as possible so that they could sell correctly.
Yeah. Two of my what I call long-term consulting engagements. One was for a public company that I developed a strategy for them as a consultant. And then they asked me to join as COO to help them groom and change the company so it could be sold. And so, of course, we went through that process. And selling a public company is a lot different than selling a private company, by the way.
Yeah.
A lot more regulations you got to deal with. So we did a lot of work, obviously, with private equity there, and we did succeed in selling the company. And then the second time, um, that became pretty intense with PE was I'd been brought in as a consultant to help on a very large private company, and they asked me to join as president, which I did. And we spent a few years grooming that company and getting it ready for sale. And then we went through a true full process, hiring bankers, going out to private equity, doing all the things that we did. We ended up selling to a strategic, not to a PE in the end, but still fascinating process to go through.
Yeah. Do you remember either of the numbers on those in terms of, when you actually joined the company, what it was valued at, compared to when you guys actually sold? Do you remember the percentage increase on, from where you started to a couple years later?
Obviously, I want to protect confidentiality, but what I will say is on the private company, when I joined them, the valuation was about 95 million. And when we transacted, it was over 140.
That's pretty impressive. And that was what, 3 years or something?
Yeah, just under 3 years.
Yeah. That's awesome. So that's how you do it, folks. I was gonna ask you about kind of building out that private equity division and if that's changed anything in your firm's approach. But like I said, you got such experience in it already. I think it's just another revenue stream for you and your business, right?
Is, but I think it's also helped us a little bit in that we understand better now what drives company valuations because we're on the inside and we see it so often. So it helps us when we are engaged with a private firm in particular that's an entrepreneur driven firm. We can actually advise now to say, hey, of these six strategic goals that you have for 2026, let me just tell you that these three aren't going to drive any value whatsoever. If you want to do them, that's fine, and we'll help you. But these three will. So it gives us a lot more precise capability to tell business owners and corporate entities, here's what's going to drive value, what's not. And then they can make decisions around that. So I'd say it's helped us a little bit in understanding that. But I think it also helps us to understand, private equity in itself. How they acquire, what they're looking for in healthcare, what excites them, what doesn't, what they use for valuations and how they look at value. And then even further, how they decide to exit. Because that's a fascinating part of the business that people don't talk about is private equity is not in there to spend a lifetime with that
Right.
business.
Right.
They're going to flip it at some point. Now, some stay longer than others, some are quicker than others. But the reality is, at some point, there's an exit strategy for every private equity firm. And that's also a fascinating part of the business.
That's true. And how do you know, when's the right time, right? Because you think you probably reached kind of like a peak, and that's where you're going to want to exit up here, where maybe your next level of growth is going to cost, a lot more money or a lot more time. And you weigh your kind of pros and cons, and you're like, I think it just makes sense to exit up here.
And
But how do you know that?
yeah, and keep in mind that every investment is not a winner.
True.
So, private equity firms, depending on the type and structure and size, they may invest in five or six companies in a year, and only one or two will be a home run. You might have some that you actually have to exit because they're failing.
Yeah.
So that part of PE doesn't get talked about very often, but it's very important because the overall portfolio of companies, the idea is you want to build that value. And when you have a fund inside of a private equity firm, you want that fund to be delivering, obviously an excellent return to its investors. Or the next time you have a fund, you won't get anybody to put any money in.
That won't happen.
So there is a lot to understand in there. And the fact that we now have that expertise, from my long term of doing it, but now also because we are actually doing the work. I think it makes us more valuable as consultants because we really can guide people about what to expect.
Yeah, I think it's not an easy skill to have in your pocket. I would say it's not something most consultants are going to be able to do at that level that you guys are doing it. But switching forward to kind of the healthcare industry as a whole, you've been in it a long time. What trends are you seeing right now that maybe excites you the most?
But it's funny. Most of my peers in this business are retired. They're sailing or they're in Florida or they're drinking too much nice wine or they're traveling Europe or whatever they're doing. And people ask me often, why are you still in the business? And my response is because I think it continues to be very exciting. And I'm an E-type personality. I'd be bored. I think if I were retired,
Can only
uh,
sail for so long.
yeah, look, my dad worked at his desk till he was 85. And I think I have some of that DNA in me. But to answer your question directly, the things that are exciting to me right now and the trends in healthcare that get me up in the morning and that I'm focused on, I would say are the following. One is the continued growth of self-funding inside the healthcare space. 68% of all private sector health plans today are self-funded, which means, you're talking 110 million people that fall under those programs, and it's growing and continuing to grow. So that's exciting. Second is,
Before going to the second, and why do you think that is, by the way? Why do you think that number is climbing up? Why is that growing?
well, I mean, very clear evidence why it's happening. There are two big drivers. So the first is that a self-funded plan is governed under ERISA. It's not governed by state insurance rules. So it gives a lot more flexibility to what the employer can do with the benefit plan. They can design whatever they want. That's number one. Number two, because the employer is taking part of the risk and the reinsurer is taking the other part, it again gives them all kinds of flexibility that they can do. But the third reason is, and this is the most important, you can manage your spend directly. Whereas when you buy a Blue Cross or an Aetna or a Cigna plan that's fully insured, they're managing the spend, not you. And they're making the profit, not you. In
Right.
self-funding, if you manage your plan well and come to the end of the year, you have excess funds over what you expected to spend. That's yours. So but the other big driver for self-funded growth was the advent of ACA, Obamacare, as you might know it.
Mhm.
So because that came in, what that did is that caused a lot of increases in costs because there were a lot of subsidies that were built into that.
Yeah.
Insurance companies had
Yeah.
to bring that money somewhere. So the fully insured side of the fence, the premiums rose very, very rapidly over a decade. And so that forced a lot of smaller companies that traditionally wouldn't have looked at self-funded to now look at self-funding because they were seeing 10, 15, 20, 25% increases every year. And that's unsustainable for any business.
Right.
So those were was for it.
And then what? So, it seems like if you're, I guess I'm a little confused. Like, why even go with the Cigna Blue Cross? Like, why go with the major ones? Is it just because you don't want to take on that responsibility of managing it, even with that upside of, if you manage it well, you make the money back? Why wouldn't some companies do that?
Well, it does take work.
Yeah.
So first of all, you got to have somebody on your staff that's going to actually pay attention and look at the benefit plan, look at all the reporting, manage what's going on. Secondly, if you're going to go self-funded, you better have a great consultant or a broker because if you're making widgets, you don't know enough about a health plan to run a health plan. So you've got to use the right source on the outside to help you. But again, if you look at the statistics, the number of companies below 100 employees that are now self-funding is just skyrocketing because, again, the Cignas and others of the world, the rate increases are just outrageous and they can't continue to maintain their staff and stay competitive with whatever product they're offering or service they're offering. That's what's happening. And more and more of them are being forced to look at self-funding. Now, to be fair, as an industry, when this started to happen 10 years ago, we really started to develop new kinds of self-funded products that were simpler and less complicated than traditional self-insurance products that the big companies had. So GM has a staff of hundreds of people that do nothing but work on the employee benefit program. If you are a 25 life, iron worker shop, you don't have that kind of capability. So
Right.
the industry has also morphed some to help those smaller companies, but that's been really helpful. So Self-funding, very exciting. Second is transparency. So in 2021, we passed a law called the Consolidated Appropriations Act, a federal law, and it brought into perspective some very stiff regulations about transparency, about having to tell the truth about things that are going on inside of the healthcare space.
I'm
And,
sure
you know,
everybody was like, I didn't even know that law happened, but I'm so glad it did because we definitely needed it.
it did, and it put some pretty big teeth behind it. And so I'm super excited about that because part of my career, I gave it up about 2.5 years ago, but prior to that, I was on the speaking circuit pretty much most of my career. Somebody other than me has kept track of it, Nicholas, but I'm told I've delivered over 715 speeches on healthcare around the world. So what I know about that is that, people learn from their mistakes. And in our industry, there's a lot of things that were going on that I saw because I was on the inside that people
Yeah.
couldn't see on the outside. And I became a little bit of a whistleblower. And that was very uncomfortable for a lot of people and for me because I didn't like doing it, but it needed to be done. So this transparency is absolutely exciting for me because it feels like I've been on a long journey and finally we're getting to the point
Yeah,
where
like we're getting somewhere here.
government is saying, you know what, he's right, you need to do that. So, but it's early. It's early stage, and we're not, we're seeing progress, but we're not there yet. The
Step in the
requirements
right
in the
direction
law
though.
are not being met completely. And obviously, anytime you have new regulations, people are looking for ways to get around them.
Yeah, always
So all
loopholes.
that happens. So that's the second thing that excites me. And the third, I would say, is the black eye to the healthcare industry for a long time has been the drug side of it. Um,
Yeah.
it's not quite as bad as illegal drugs, but it's pretty mafia.
Yeah.
And it's been going on for a long, long time. It's been unacceptable. It's a terrible cost burden to everybody, not just the employers. The members are facing it just as much. So that PBM industry, which is dominated by three big players, they control 85% of all the prescription drugs in the United States of America. Those three are at best the causes and at worst might be borderline criminal in what they do. And so exposing that and seeing the government and others starting to look into and really digging into, hey, what's going on here? Now, part of it is just because it has become so expensive. Back 20 years ago, prescription drugs accounted for maybe 5 to 6% of the total healthcare spend in a health plan. Today, it's over 20%.
Wow.
It's ridiculous the amount of money we're spending. Now, part of that, people will argue, and I often get into debates. And by the way, I love debates.
I bet you do 720
People come
speeches
and say,
later.
but Larry, the reason is because we've invented all these wonderful new drugs that cure all these diseases. That is
Mm,
part of it. No, no, that's part of it. Those things are expensive, research and development, etc. But I always counter with this, Nicholas. And my counter is, well, if that's the case, then why aren't we focusing all the manufacturing drug spend and money on R&D? Why are we spending $14 billion a year on consumer advertising? You see,
my
I mean,
gosh.
watch a football game and
I
then
know, but
everybody,
why am
let's
I
take
seeing
this
that on
drug.
a football game? I don't understand.
And the minute you see the ad, they're all the same. I'm cured and I'm dancing through the fields and
I
I'm
like the end where it says side effects include and then just
and then
goes like
the
boom.
side effects are absolutely deplorable. Well, here's an interesting fact for you, Nicholas. There are only two countries in the entire world that allow
Yep.
for drug advertising. United States and New Zealand. I forgive New Zealand because those guys, they're too busy playing rugby and drinking beer, and God bless them. There are only 300,000 people there.
Yeah,
We
it's
are
not a big place.
350 million people. There is no excuse for drug advertising in this country. And my point is this. If we took $14 billion, and that's a minor estimate, some say it's well over 20, and put that back into lowering the cost of drugs, we'd have a massive impact. We would really help a lot of people. And guess what? You can't make the argument, well, you'd have less research and development. No, you wouldn't, because that marketing piece is not part of research and development. So I'm a big proponent of it. I think we should ban it.
I agree.
There is a bill right now to try and regulate it more, but I don't think that goes far enough. I think it's time to just say we're going to join the rest of the civilized world and say we're not advertising drugs.
I've been on the couch so many times and looked at my partner and been like, I don't understand why this is a thing. And, the fact that it's that big of a, 14 bill, maybe 20 that they're spending on it. I mean, it just doesn't
It's
seem right.
crazy. It makes no sense whatsoever. So that part, the fact that we're starting to look into the PBM industry, that excites me, and I'm doing a lot in that space. And then I guess the final piece I'd say that excites me about it is technology. The influx of AI into our space. I think there are amazing things that are going to come out of that in the next 5 to 10 years. And I'm excited about all the things we're doing and can do there.
Nice. I actually put that down as a last minute question here on there of like, any thoughts on AI as a trend in healthcare and, where you see it going. So you're excited for that. That's good.
I am. I am. Yeah.
Nice. Well, I think it's about time we gotta let the listeners know, can you tell them more about what you've been, religiously working on with your new, self-funded health plan that you're looking at launching and why it matters for maybe, more mid-sized companies?
Yeah. This is a passion project for me. We've done so much in the business. I've done so much in the business over the years, and what I recognized was I said, look, we need to go in scientifically and look at what really drives the cost of a self-funded plan. So I like to do things all data driven. I don't like things that are just, opinions. Social media
I got
has
a
made
gut feeling about this.
Social media has made me um, very negative about opinions. My grandfather used to tell me that opinions are like noses, but I don't necessarily want to see yours. So the reality is, I said, let's do this as a data-driven project. So we got access to look at about 250,000 people and all their self-funded claims, which is a massive data set. Companies throughout 47 states, ranging in size from 100 lives to 12,000 lives. So big spreads. Credibility was great. And we dove in. And what we found was nothing that we didn't expect, but it was much more precise than we thought. There's 6 things that drive 88% of any self-funded plan spend. So being the people that we are, and me really, because it was all driven by me, I said, look, if we could go into those 6 categories and find the best performers in each one of those 6 categories and bring those together in a hybrid, vertically integrated health plan, we would be able to deliver the most efficient, lowest cost, best self-funded health plan in the country. It's just logical. Well, that started the journey. First of all, you had to go and analyze all that data.
Yeah,
Secondly, then I had to go and look for the top performers in each. And performers, a lot is done in our business because of contacts. So, hey, I know Nick, and Nick works for ABC, and he's a good guy, and they do this, so I'm going to start using ABC. We
right.
refused to do any of that. We went to these companies and said, will you provide us with at least 3 years of performance data? So if it was a drug PBM, we wanted to know performance wise, what have you been filling drugs at? What were the claim numbers, et cetera, et cetera. If you are a TPA, what administration, what cost savings have you done? If you're a cost management company, if you're a behavioral health company, we went to all of them. Of course, a lot of them refused to give us the performance data
Right.
because they weren't performing. And particularly with my reputation, they knew that I would uncover that. And unfortunately, if I did, not that I'd publicly go out and say it, but people may find out.
Right.
So what we did is we ended up with about 65 companies that provided us with all this data. And we created a tiny little data set of performance, 50 different data sets with 6.5 million lines of performance data. We don't think anybody in the industry has ever done it before. And so we took that data, and that data then led us to make conclusions. So we were able to say, this is the best performing PBM in the country. This is the best performing orthopedic MSK. This is the best performing administration. But we knew that what we thought and what we analyzed wasn't important, Nicholas. What was important is the gods of the health insurance industry. And they're called actuaries. They're very, very bright people who study mathematics for a lot of years. So we said we got to go to the actuaries. And if the actuaries review all this data and come back and agree with us, then we know we have something. So we went to 3 different independent actuarial groups, gave them all the data, and said, here's the thesis. If we develop a health plan that uses all of this, and we put it up against the Blues, Aetna, Cigna, everybody, against any other self-funded plan, could we save a client 10% on their total spend? Everything. Because we don't think it's worth it unless we can do 10 or more percent.
Right.
We're very nervous. We didn't know if it would come out, and I'm happy to say that in the markets that we told them we'd be in, they analyzed it, they came back and they said, yeah, not only will you do 10, in some markets, we think you'll do 20 or 25. So we said, great, that's fantastic. And we then trudged along. We found some big reinsurers that agreed with us. We built the plan. We found all the pieces. We contracted with the vendors. 18 months of just solid heads down while we were still running our company. And we pulled together Harmony Health. And we stole from Aristotle in saying that the whole is greater than the sum of its parts, because that's what harmony is. We pull together all these different, distinct parts, the 6 moving, if you
Right.
will, runs, but it's how they work together and its synchronicity of them that generates the overall result. And so that product is now developed, and I'm happy to say we are doing a soft launch this month in 7 markets around the country, and very quietly, very select. Next year, we'll turn on the full afterburners and go wider. Healthcare is delivered locally, not regionally or nationally. So we
Right.
go market by market. We don't do this. We don't do the scatter plot kind of thing like the Blues or Cigna or Aetna might do. We go network by network. And why? We actually partner with the providers in each community. So we'll go into a community like Chattanooga, Tennessee is one of our markets.
And are you sending like boots on the ground with that, or is it more of a, kind of a mobile outreach?
No, self-funded business, 27% of all self-funded cases have a broker, and those
Mm.
are licensed insurance brokers. And
Yep.
there's a select set of them that are really talented. Distribution for our plan is done by hand-selected brokers in each market. So we go into each market and find the really best, and then we let them sell Harmony. And so that's the process we're in right now. And
Okay.
and that's really fun to do. So great passion project. I'm excited about it. I think the numbers are going to be good. The things we're doing and the way we'll be able to simplify stuff for employers is going to be excellent. We now have 2 versions of it, one for smaller groups going down to 25 people. Then, of course, for larger groups, all the way up to, 20, 30,000. So we're pretty excited about it. And, next year will be a building year, but we're confident now with all the actuarial science and data behind it. There's no question we're going to be very competitive, and we're going to help to level off that trending curve. So the objective is save people, 10% going in. And I know that doesn't sound like much, so let me give you some figures so that you can kind of tell your viewers this. We just recently had a 341 life company that quoted with us. They're currently spending today just about $6 million a year in all their expenses around their
Wow.
self-funded
Yeah.
plan, right? If they go with us, we will guarantee them to be at 5, so they will save $500,000
At
guaranteed
least.
that they
Yeah.
can put in their pockets. Now, we always tell our clients when we bring them savings, do the right thing. Don't put it in your pocket. Go back and lower the contributions for your, because a lot of people not in the industry don't understand that while you see on TV and on social media and on broadcast that healthcare is rising at 10, 12% per annum, we all think about the company. But what we don't know and what we don't pay attention to is a lot of those rate increases have to be passed on to the members. So the average American family of four today is spending more than $28,000 a year on healthcare.
Wow.
That's unsustainable. In some
Yeah.
markets, it's 35. That's a lot of money. So we want to see if we can lower the cost of the actual claims and the plan. We want to see the companies take part of that savings and give them back.
I mean, that's such an awesome, like, that if that's the mission, I mean, that's actually something that has impact. I mean, even from the company level right down to your community.
Precisely. And we love it because since we're doing it locally, we're working with the local providers. So it's all really a local effort. It's going in Chattanooga or in Orlando or in Denver or in San Antonio. We can actually say this is good for the community. You have your company headquartered here in San Antonio. Yeah, you may have some employees outside of San Antonio, but the core is here, and you're going to be seeing providers in your community. And that's what we want to do. We want to make those connections because we want to try and get the big insurance companies out of the middle. Healthcare is about taking care of patients. People's health is critical. And the best way to do that is to connect the providers with the patients more directly. And we think through self-funding and Harmony Health, we're going to do that.
That's awesome. Well, I can't wait to see it all unfold. What do you think your biggest challenge is waiting ahead of you?
Well, there are a number. Obviously, anytime you launch something new, you've got to get it out there in the marketplace. You got to get distribution. Every time we want to do a new market, it's complex because we're negotiating directly with those providers. Some health systems, it's sad to say it, but some health systems in this country, they don't care. They just want to make money and they don't want to negotiate. They don't want to provide a better program. They're really happy with the big insurance companies. So Harmony will not be everywhere, and that's sad to say, but it's factual. We will do it as much as we can in as many places as we can, but we're a small company. So the other challenge we have is capital. We have limited resources to go out and do this. In 2026, we have on the roadmap of five, maybe six markets, and we'll just keep doing that. So that's a challenge. The second challenge, quite frankly, there's there's no intellectual magic to what we're doing. So we fully expect that once we get some traction, the copycats will come flying out of the
Right. Yeah.
woodwork quickly. But I have a surprise for them, Nicholas. So it's okay. Keep
I
that.
like it. We're thinking ahead here.
Right. There are three phases to Harmony. All they're seeing is phase one. There's more to come.
There we go.
But we think it'll be interesting. Then, of course, just general economic, situation. The economy has to continue to grow. People have to be hired. Employers have to spend. But right now, those are all lining up to be reasonably positive. So we're encouraged.
Yes. And with those markets that you guys are looking to go into, is there any I'm sorry, is it any I know kind of how you go for the broker. Is there any actual marketing in terms of like would you ever run campaigns and ads, or would it just not get you to the target audience that you need to get to?
Yeah, we do. Absolutely, we do. Sometimes we run marketing campaigns to get to the brokers in that community. So we just recently in the soft launch did in three markets, we did a pretty heavy LinkedIn release combined with a targeted email campaign that
Nice, yeah.
went out to 1,500 select brokers in three markets. So yeah, from time to time we do that. And then from time to time, we will actually, go in and reach out to the employers in the marketplace to let them be aware. But one of the fun things we're discovering is when we bring the providers in and the providers are engaged, they become really good disciples for us. And there's something to recognize. Insurance brokers and insurance people are among the least trusted industry in the world.
For sure.
That's how we're looked upon.
Yeah.
We're the most trusted
Oh, you're
doctor.
a doctor. Yeah. My physician, my doctor, pediatrician, you
So
know.
if you get the doctors involved and they start telling, the CEO of the manufacturing company that comes in for his annual checkup and is whining about healthcare costs being too high, And the doctor says to him, we're contracted with a program called Harmony. You might want to look at them. That's 10 times more valuable than brokers calling and doing email campaigns
Yeah,
because the credibility is there. So that's the other part of our model we're so proud of, Nicholas, is when we talk about Harmony, we talk about service. And many insurance plans focused on the member experience. And don't get me wrong, that's absolutely important. But in Harmony, we think the service experience has to include all parties. So the member, the employer, the providers, and all of our partners. Everybody has to have a good experience, and
right.
all of us have to work in harmony. If we're not harmonized, it fails.
It's a very smart move going with the providers first because I've never, it's a great connect the dot situation. I know everybody's sentiment towards anybody that calls them to switch over, like for Medicare or if you want
Yeah,
life insurance. I mean, it's not, there's not a lot of trust there. And vice versa too. I've had some friends that have, worked with companies, selling for companies, life insurance or whole, or Medicare or Medicaid. There's been situations where they've sold, maybe $200,000 or something worth of stuff for them, and the company never pays them. So there's also, very bad
there is.
smaller insurance companies out there that deserve the reputation.
Yeah, it's true. I mean, look, every industry has what I call my favorite Clint Eastwood movie, The Good, the Bad, and the Ugly. And there is no industry that can claim it's pure. The bigger the industry and the more pigs that are at the trough, the more problems you're going to have. And healthcare has more pigs at the trough than practically any. I mean, we're the second or third largest industry in the world, and certainly in the United States. And so when there's that much money, the seventh deadliest sin comes to rise, which is greed. And so I make no excuses. I think it's unfortunate and I hate to see it. And when I see it, I call it out. But it does happen. And yeah, the reputation that we have comes from those mistakes.
It does. But like you said, you wouldn't still be in it if it didn't excite you. And there's some exciting things that have happened, at least in the last 5 years, that are moving the industry slowly, maybe, but surely in the right direction. So it's uh it's
It's a
good to hear. It's good to hear your thoughts. And I think there's so many listeners and myself included out there that, have an understanding of how healthcare works, but don't necessarily understand the figures and the data and some of the topics that you brought forth today. So I want to thank you again for joining us. I really enjoyed speaking with you. It's very insightful. And I think anybody out there that actually listens to this episode is going to learn a great deal about the healthcare industry as a whole, a lot of things you didn't know. And we have to thank Mr. Lawrence Thompson for that because it was a really insightful conversation.
Thank you so much for having me. I appreciate it. Always, always happy to share about the industry and the journey.
Yes, awesome. Well, I'm going to wrap us up here. To our listeners, thanks again for tuning in to the Optimized Business. Be sure to follow the show for more insights on leadership, growth, or scaling your organization. I will have Lawrence Thompson's information on LinkedIn if you want to send him a connect request or any positive feedback of enjoying his insight. I'm sure he'll be very accepting of that. So thank you guys again, and thank you, Lawrence, for joining me today.
Pleasure. Thanks.